Hello, Dr. Vikki Petersen here. I wanted to talk to you today about some research that I noted that came out not even 2 months ago. It was the middle of December last year. This was from the University of Florence in Italy. And just saying that made me happy because Florence is such an amazing city. But back to the research. So what these researchers were looking at was potential celiacs. So they had a group of individuals who were not diagnosed celiacs, but they had the potential to be because of familial celiac, etc. So it was a suspicious group, but a group that based on current testing had not found that they were celiac. So they were eating gluten and there were no tests to kind of tell them otherwise. So what these researchers did was they compared these potential celiacs to celiacs and also to a group of controls or healthy people. And what they found, the way they measured was they looked at metabolic profiles. So in other words, factors in their blood, factors in their urine. And what they found was that when it came to the bloodstream in particular, the celiacs and the potential celiacs were pretty identical. They really couldn't distinguish a difference between them, which is very interesting, but we'll come back to that. The other thing they did as far as the urine values was to, in the urine values, what they figured out was that the urine more showed the typical damage that we know to occur in celiac. So you get the villus atrophy, all that damage to the small intestine, and that was more shown in markers in the urine. In other words, the celiacs had markers in their urine showing intestinal damage akin to what we see on a biopsy, but those who were potential celiacs did not show that in their urine. So their blood was almost identical, but the urine was different. So what's particularly useful about this is that we have some early measurements that we can see, because once again these potential celiacs were told they were fine by the testing that we typically use. If you go into a gastroenterologist's office in this country and say, I think I have celiac disease, they'll run a couple of blood tests. If those are negative, they won't run a biopsy. If the blood test is a little bit suspicious, then they'll go ahead and run the biopsy. And if the biopsy is negative, a lot of times you're told you're absolutely fine, even if the blood was a little suspicious. So I hear stories like that from patients all the time, and that's pretty much the operating basis today. But what this research showed is that is waiting way too long, which is exactly what I've been saying for a very long time, so that we can have these earlier measurements, because they measured a particular amino acid in these patients, both the celiacs and the potential celiacs, and of course the control. And what was interesting about this amino acid is that it's known to show positive when there is damage to the small intestine. So you say, wow, isn't that the same as celiac disease? Well, celiac definitely has damage to the small intestine, but it's very severe. Remember those finger-like projections that make up the lining of the small intestine and allow you to absorb nutrients? They're pretty much mowed down in a celiac. But what this amino acid test shows is very, very sensitive changes. So there's irritation, there's inflammation, there's definitely some damage occurring, but is it as severe as we see on a biopsy? The answer is no. So it's a good early detector, because this amino acid test, it's called citrulline. The name is not important, but anyway, just in case you were curious, this amino acid test was positive on the celiacs as well as on the potential celiac. So that's one of those blood markers I was talking about, but it was completely negative on those healthy controls that were not in that category. So even though the potential celiacs showed no evidence of damage on an intestinal biopsy, they absolutely showed damage based on this assay or test of this amino acid. So what does this mean? It means that our tests for celiac disease are not sensitive enough. I'm absolutely convinced that we'll look back on this period of time maybe in a decade, hopefully a lot less, we will look back and say, what were we thinking? thinking that an intestinal biopsy was a good measurement, that it was a good detector for damage. We'll look back on it and say, my goodness, it's like waiting for someone to have a heart attack to let them know that they have any illness in their heart. You know, you wouldn't want to wait. Wouldn't you want to know a lot sooner that you were at risk for a heart attack? You don't want to wait until after your first heart attack for someone to tell you you have a problem. It's the same with celiac. We don't want to wait until that much damage has occurred in the body to then diagnose someone. So what's very exciting about this research is giving us an inkling of some tools that we can use to assess for early change and early damage. And that way we can get people off gluten that much sooner so that they don't have to go down this road of so much damage and then getting another autoimmune disease or getting cancer and all these terrible things associated with celiac and gluten sensitivity. So the good news is these tests are on the horizon. Much more research is being done in the area of gluten sensitivity. And what do we do right now? What we do is try to get tested. We can't use tests that don't exist currently within that model. In other words, if you went to your medical doctor and said, I want a citrulline assay, they probably would say no, because this is research, it's in a university, they're doing it for a very particular purpose. But what you can do right now is, yes, get tested, find out if a celiac test is positive. If it is, of course, you know, that's great. Move on and do everything that you need to do. But there are other tests for gluten sensitivity. The caveat there is that we still do not have the sensitivity that we need, meaning a lot of people are going to be told they're fine, even though they are not, because the test says they're fine. So don't pull your hair out. Don't wait forever. Do the next tier, okay? You have control over this. You can then eliminate gluten for 30 days out of your diet, see how you feel, and realize that if you feel better, that is a positive test. And let no one distract you from that knowledge that you have done your own personal test, and if you feel better, that is good enough to go forward and remove gluten from your diet, because there's really no reason for millions of people to continue suffering while the research catches up. But I'll just keep you apprised as that happens, so you know that it's getting closer and closer. And do share this information with friends, because there's a lot of people that are holding on to that intestinal biopsy as the make-break point between black, white, yes and no, celiac or not. And it's not. It's really not the gauge that we want to use to measure this kind of damage. So I hope you found that informative, and until next time, I wish you very good health.